You're not crazy. It is menopause. It's a thing. Diet and lifestyle is important. I want to talk a little bit about the Women's Health Initiative because I think we can't talk about hormones unless we talk about that.
All right, it's time. And y'all know how we do here in Viva Life. I'm Dr. Kelly OMD, your board certified OBGYN and healthcare executive, here to help you live your healthiest and wealthiest life. And the way that we do that is we focus on the five pillars of life, which are spiritual, physical, financial, mental, and emotional. And the things that we offer to you, you're on one tonight. It's our webinar. It's called Ask Dr. Kelly OMD. Our podcast is called Viva Life SPF Me, and that posts 3 times a week, if not more, as well as something we have called the affirmation room, which is when we come together after we've done our journaling and our meditating all month. We come together privately to talk about what are the things that we are affirming, letting go, what are we calling forth, and what are we grateful for. The reason why is because we understand that doing that decreases stress and it improves and optimizes our ability to not just be functional, but thrive throughout our life, whether it's professionally, personally, or in our community. But tonight is not about me. It is about my colleague, and her name is Dr. Karen Johnson. I am so excited to have her here. She is a fellow OBGYN, but she has a little bit something more special to add behind that name and to her experience. So, Dr. Karen, tell us a little bit about yourself as well as the top 3 things you want us to take away tonight.
Hello, ladies and gentlemen. Thank you so much for joining the call. So, the things I think we're going to talk about menopause this evening. So, what I want you to know is that you're not crazy. It is menopause. It's a thing, and we can get into the details and talk about it. The second thing I want you to know is that diet and lifestyle is important. And the third thing, I want to talk a little bit about the Women's Health Initiative because I think we can't talk about hormones unless we talk about that. So that would be my kind of third and fourth thing to talk about the Women's Health Initiative and hormone replacement therapy. And I also want to talk about hormone replacement therapy as a longevity medication or lifestyle versus just a medication. So we want to talk about longevity and living a long life and living a prosperous life and living a life that's worth something.
Oh, I absolutely love that because we talk about this all the time, living life in abundance to the full until overflowing. And we don't want to just be here on earth. We want to experience the fullness thereof that has been offered to us. So that being said, tell us a little bit about we know you're an OBGYN, but what's that extra special certification that you've gotten? And why did you choose to get that extra special certification?
Sure, yeah. So I'm obviously did a residency in obstetrics and gynecology. I practiced obstetrics and gynecology for over 20 years, but I've always been leaning more toward lifestyle. I always tell my patient food is medicine. So I've always been sort of in the functional space. Around COVID, I decided to kind of shift my career and shift my focus. And I did GYN only, and then I got a certification in functional medicine. And that's kind of what I've been doing for kind of the last 5 years, and it's really fulfilling for me.
Oh, wonderful. So can you tell us what functional medicine is? People may not understand what that term means.
I think I said food is medicine. So food and lifestyle is functional medicine. And it's not alternative medicine or it's not voodoo or it's not other things people call it. It's basically healing yourself with food and with lifestyle, with exercise, with decreasing stress, with honoring yourself. That's functional medicine.
And I think that's just so important, especially as we're talking about the perimenopause and menopause transition that, like you've said, every single woman, if she lives past the age of 60, is going to go through. So can you just define for us what menopause is, perimenopause is, and what we have to look forward to?
Sure, of course. So, premenopause is when nothing's happening. So that's when you first start your period to around 40. And then from 40 on is basically perimenopause. And menopause is when you haven't had a cycle in one whole year. So people get tripped up about that really, but it's one whole year, 12 months. And lots of people have their cycle until their 11th month, and they're like, it's coming, and then they have a cycle. So you're still not postmenopausal. You're postmenopausal when you haven't had a cycle in 12 whole months. And what do you have to look forward to? And I don't know if I want to consider it a looking forward to, although every day is a blessing. But when you go through menopause, you lose estrogen, you lose progesterone, and you lose testosterone. And what does that mean? Well, estrogen is protective, as I spoke about earlier. So it protects our brain, our bones, and our heart. And when we don't have that, then we're at risk for osteoporosis, for dementia, for Alzheimer's, for cardiovascular disease. So it's a full-time job, really, honestly. I describe it as that because you almost have to do everything right. You have to eat right, you have to exercise daily, you have to decrease your stress, and some women opt to take hormone replacement therapy during this time.
Yeah, I mean, I know I've been looking and, of course, doing our research and our academia, right? And seeing that there's over 50 different symptoms that are associated with menopause. And I think it's really important for, like, as you're saying, to understand what are these different symptoms that can happen to your body starting in your 40s. And sometimes people have this starting in their late 30s or mid 30s because our hormones are constantly changing, but the significant decrease definitely in our latter 40s. And then one of the other things is something I like to say is menopause is technically for the rest of your life. Now, you might not have all the symptoms, but being in that phase of your life for the rest of your life is a real thing. And I don't think a lot of people really understand that. So I'm glad that you're here to help us with that piece. Now, you also mentioned, food as being a part, food is medicine. We talked about that functional medicine piece. How do we navigate our food choices, our nutrition choices, as well as our exercise, especially in that time when you're really going through that transition from perimenopause to menopause? A lot of women talk about the weight gain that they have, the hot flashes, the vaginal dryness. Can you help us navigate through that piece utilizing the functional medicine aspect?
Sure. So basically, in general, but especially in perimenopause and menopause, weight training is key. You have to lift heavy weights and you have to eat as clean as possible. And I'm not saying you can't ever have some sweets or you can't ever do this, you can't ever do that. I'm saying 70% of the time you should eat clean, and 30% of the time maybe you don't eat as clean and you have a treat or something like that. Um, but the exercise is really key. It's good for your brain, but it's mostly important for your body. And if you have more muscles, you can eat more food because when you eat the food, the glucose goes to your muscle and not to your liver or your belly and other places that we don't want it. The reason that you get the little pooch, and even really fit women, you'll notice fit women in perimenopause and menopause still have that little pooch. It's because your body is trying to make estrogen. Because the body is really smart. Because when the ovaries stop making estrogen and testosterone, then there's a little gland on top of your kidneys called the adrenal gland. So then the adrenal gland starts to secrete all that stuff. But the adrenal gland also secretes something called cortisol. And I think most of you are probably aware of that. Cortisol, that's the stress hormone. So there's competition. There's competition between estrogen and progesterone and cortisol. And so, quite frankly, the adrenal glands tell your body, give me some more fat so I can make estrogen because I need the estrogen. So that's kind of what happens with the weight gain. And it does happen. I mean, it's inevitable, but I think you can avoid it by eating clean most of the time, 70 to 80% of the time, and exercising regularly. When I say regularly, I mean almost every single day. Maybe you take Sunday off.
So let's get into that. Somebody asked a great question. What is clean eating? And I will tell you, even in your 30s and 40s, if you can eat clean, I think I felt the best ever. I mean, I used to have bad PMS or PMDD, which is, premenstrual, perimenstrual dysphoria, depression as well. But when I was eating clean, and I know you're going to explain what clean is, man, I felt like that just went away. So break down to us what clean eating is.
Well, it's, protein and vegetables. You don't really need a whole bunch of carbohydrates, but there's also a way to eat the food on your plate that's beneficial. So you eat your protein first, eat your vegetables, and then you eat a complex carb. Avoid whites. I'm sure everybody have heard about that, avoiding whites. And then also, I do recommend to my patients, and I've done it several times myself, to wear a continuous glucose monitor because the biggest issue is inflammation. As we're aging, the biggest issue is inflammation. Inflammation causes high blood pressure, it causes high cholesterol, it causes diabetes and prediabetes. And lots of people have prediabetes. And sometimes your doctor may or may not mention it. Your hemoglobin A1C is 5.7 or 5.8. That is not normal. It should be like 5.5 or even less. So that's kind of one of the things you do. You got to sort of try to eat clean and eat. And if after you eat, if you can walk around, even if you're just walking in your house for like 15 minutes, that decreases your insulin. It really decreases your insulin because when you eat glucose. The insulin has to put the glucose into the cell. So there is a continuous glucose monitor that you can get over the counter, and you can wear it for just 2 weeks, and you can take notes and write it down. And when I was wearing it, I was thinking like, oh my gosh, brown rice, I can eat brown rice. That's good. They say eat brown rice, don't eat white rice. Well, it was really spiking my sugars. And your sugar is going to spike, but how long does it stay up is the issue. So you can wear that.
No, I think that's important. I did want touching on the continuous glucose monitor. Thank you for doing that because a lot of people think, oh, that's only for people that are actually diabetic. They have these continuous glucose monitors. You got to be in a program and all of that. There are options for you to do it over the counter as well as through your primary physician that you're seeing. But I know we used to notice it like when we're taking care of gestational diabetics, right? Or diabetics in pregnancy, we have them taking their sugars 4 times a day and they eat certain things. They take their sugar 2 hours later and they're like, oh my God, I ate this and I thought it was good, but my sugar was still high. So being able to, monitor throughout the day, what is it that your glucose levels are doing? And like you said, that's causing inflammation in our body. And that inflammatory response is really wreaking havoc. So many times, depending on where you are in your cycle, or even if you're not cycling anymore, that's why you're experiencing a lot of the symptoms that we talked about, those 50 symptoms that we talk about. You could be experiencing some of those because of you had this chronic inflammation. The other thing you mentioned was the cortisol. And I think that people have heard about like the cortisol face and the cortisol roundness that people get. Can you touch on that a little bit more? Because as we know, women tend to carry significant amounts of stress. Anybody in like high performing experiences or who are high performers carry extreme amounts of stress as well. So can you talk about that a little bit more for us?
Yeah, first of all, I want to mention that you cannot test cortisol in isolation. So if you go to a physician or get a blood test or whatever, and somebody tests your cortisol, well, that doesn't mean anything because cortisol should be high in the morning because you're up and you're doing things, and it should be low at night when you want to go to sleep. And since I'm talking about sleep, I'm gonna get back to cortisol, but since I'm talking about sleep, that is the first symptom that a lot of people have is waking up in the middle of the night, and it's classic. You wake up between 1 and 3. The reason that happens is because of progesterone. And I want to make a differentiation between progesterone and progestin. Progestins are synthetic progesterones. That's what you have like in a birth control pill. But progesterone is bioidentical, meaning that's what your body has or had, but it starts to decrease as we go into perimenopause because progesterone stimulates gabapentin, and gabapentin is very, very relaxing. It's a relaxing neurotransmitter and it helps us sleep. It helps us feel less anxious. There's a ton of women in their 40s, they're anxious. They go to their primary care doctor. Their primary care doctor puts them on an anti-anxiety medication. Well, that's not the problem. The problem is perimenopause. And when I usually give them progesterone, then they are doing great. So the progesterone is important. I digress. So cortisol, if you want.
But let's put a pin right there because as we know, sleep is very important to, for our overall health and getting the adequate amount of sleep for our body. But I think like you were saying, the progesterone, when do you recommend progesterone? Like, do you recommend them to take it at night, in the morning? Is there a amount that you recommend to people for them to take?
Yeah, I usually talk about sleep hygiene in general.
Mhm.
So basically, your phone should not be in your room. If you don't have a dark room, you wear a mask. Take the progesterone about an hour before you're scheduled to go to bed. I also recommend magnesium along with the progesterone because magnesium stimulates the parasympathetic nervous system. That's our relaxing nervous system. And it helps. The two of them together, you'll sleep like a baby. So the progesterone comes in 100 milligrams and 200 milligrams. I have some patients who are very sensitive to progesterone. And you can get this at the regular pharmacist. You don't have to go to any compounding pharmacist. But if some of my patients are really sensitive to the progesterone, I might send them to the compounding pharmacist to get a 50 milligram. But generally, I'll start at 100 or 200 milligrams an hour before you're scheduled to go to bed, along with magnesium. Glycinate if you don't have any problems with constipation, and citrate if you're having some problems with constipation. Mhm.
Go ahead. No, I was just going to say, and just remind everybody, I think you click that little button that said these are for educational purposes only. Please talk to your own primary provider in regards to starting any supplements or medications so they can understand. And one question, is the IUD, progesterone IUD, is that adequate for people for sleep?
No, because that's a progestin. That's not progesterone. It's a slight, there's a difference in the molecular structure, but they're very different in terms of benefits.
Awesome. Thank you so much. Okay, so we digress, but that was a good digression.
Okay.
You said that you were going to go back to we are going to go back to our original discussion in regards to the functional piece of this for you.
Right, the cortisol, I think we were talking about
Mhm.
cortisol.
Yeah.
So if you ever are curious about what your cortisol levels are, it's best to take cortisol in the saliva samples and or urine, and you have to take it all throughout the day. You cannot take it in isolation. But again, cortisol is not so bad. You want to have cortisol in the morning because you have to get up, you have to do things, you want to be hyped, if you will. And at nighttime, you don't want it to be high because you want to be able to go to sleep. So there are some things that can regulate your nervous system. Acupuncture is one of them, yoga is one of them, meditation, and also just doing things that you love. And life is stressful. So we all have, careers and stressful jobs and kids and husbands and all the things, but you have to figure out what your body needs to regulate your nervous system.
Yeah, I think one of the things we talk about is in Viva Life, we very much focus on meditation, journaling, exercise. And when I say exercise, enjoying what you do as far as the exercise, making sure you get that time in, which is why when you talk about doing it 5, 6 days a week, that it's okay because you're actually having fun doing the exercise, including the resistance training and the strength training going along with that. And we also talk about optimizing our nutrition, our hormones, and our sleep. So you are absolutely touching on everything that we talk about. And the reason why is because, and this is one of the reasons why I thought Dr. Karen is going to be great on our show, is because there is definite divine alignment associated with it. But you know what? We work in totally different cities, states, but we're seeing the evidence of what we're talking about in real life, and it makes a huge difference. So thank you for that. And thank you all for asking the questions as we go. I think it's quite helpful for us. Now, you said you wanted to touch on kind of like one of the last two things for our topics today. Did you want to go into that?
Was that the Women's Health Initiative or
Yeah, just a little touching on that. And uh,
right?
yep.
I'm going to give a brief non-scientific explanation of the Women's Health Initiative. So the Women's Health Initiative was a study that was done. They studied, ultimately it was about 17,000 women, but the part of the study I'm going to mostly talk about, there were 10,000 women. And nobody really ever studies us. So that's super significant that you had 10,000 women that you were going to study. The study was called the Women's Health Initiative. It started in 1998 and ended prematurely in 2002 at 4.5 years. It was scheduled to go for 5 years. So they gave these women something called Pro, which is synthetic estrogen, oral estrogen, and synthetic progesterone. What they found at 4.5 years was that there was an increased incidence of breast cancer, stroke, and heart disease. Numbers were very small, like 7 to 8 out of 10,000. But I'm including myself, stopped giving women estrogen and progesterone, but because before 2002, everyone that you see was on estrogen and progesterone. So we stopped giving women, you can't take it, it's increased your risk of breast cancer, da 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 da. So it wasn't a great study, but we did learn a lot of things from that study. One of the things we learned was people think that it's estrogen that causes breast cancer. Estrogen is actually protective. It was the progestin arm of the study that increased your risk of breast cancer. We also know for sure that estrogen protects your bones from osteopenia, that's thinning, and osteoporosis, that's more thinning. So if you have aunts or grandmothers or ladies at church and they're shorter, That's because more than likely they have osteopenia and or osteoporosis because their spine is weakened and the bones are collapsing on each other. So that's what happens when you have osteopenia or osteoporosis, and estrogen protects us from that. We also realize that um, and this is kind of controversial, so it's not like a white paper meaning randomized controlled trial, but anecdotally, we know that there's lots of studies showing that it helps with dementia and Alzheimer's. And I know a lot of you ladies that are in menopause also notice this brain fog thing, which is kind of scary because you're like, I know the word, but I cannot get it to my brain to get it out of my mouth. That is brain fog. And so so we know that that helps with that, and then also cardiovascular disease, because the number one killer for women, some people think it's breast cancer. It's not. It's cardiovascular disease after 50. Why after 50? Because we lose the estrogen.
Now, I know you said a lot there, and all of that was fantastic. I mean, just breaking it down, the WHI, understanding that, we're talking about one or two patients difference in breast cancer incidence. And I think, that's definitely a point where people have to have a specific conversation with their provider about that. But just because there's a history of breast cancer in your family or potentially in you doesn't mean you absolutely cannot have any formulation of hormone replacement. So I think it's really important for us to understand the numbers and the risk benefits associated with you, with that person. Thank you for mentioning the Alzheimer's, the brain fog, as well as Parkinson's disease. They're finding some improvement, especially in those areas as well. That definitely happens in my family. So I'm like, okay, when should I start this hormone replacement? So let's talk about that. When should we start? If we're gonna start, when should we start, and what should we start?
Right, sure. So the other thing I just want to mention, we talked about functional medicine, and then the other thing about functional medicine is it's individualized. So it's not like I'm going to give every single one of you the same thing. Like you're going to come to the office and you're going to tell me and I'm going to give you the exact same thing. That's not kind of how it works. I mean, you'll talk to your physician about it, but each person should have what they need for them. So, to be honest, with progesterone, I start some patients on progesterone in the early 40s because they're having a really hard time sleeping and they're having a really hard time with anxiety. They feel very, very anxious. And they're like, I think I'm going crazy. Like, I've been fine. And then all of a sudden, I'm anxious about everything. I can't drive on the freeway. My kids, I don't know, everything's going crazy. So, and that's just the lack of progesterone. So, I can start progesterone really early. Estrogen in perimenopause is a little bit more tricky because estrogen goes up and down and up and down and up and down when you're in perimenopause. Sometimes it's high and you're doing great, and sometimes it's low and you don't feel great. So, if you give estrogen on top of you already have an estrogen, that's called stacking. So we don't necessarily want to do that. So I'm very, very careful, and it's very individualized whether I start you on estrogen and perimenopause. And postmenopause, you haven't had a cycle in one whole year. It's easier because your progesterone is zero and your estrogen is zero and your testosterone is usually low. So if you're interested and you're having symptoms and you talk to your physician, and it can help the symptoms a lot. And a lot of people don't necessarily do blood draws. There's some people say you don't need to do blood draws. If they feel better, then you know that that's fine. Well, I mean, that's true, sort of. But when you do a baseline blood draw and then repeat it after about 2.5, 3 months, it kind of tells you where you should be. And we know that the estrogen number needs to be around between 40 and 60 to have those protective benefits, mostly the osteoporosis benefit. So you start when it's time, and everybody's different. There's not an age.
I love that. And it's true. And that's why it's so important when we're having these conversations that they're not 3 to 5 minutes long with our providers, that we can actually have full on conversations and talk about, okay, what are the different symptoms that you're experiencing? What are your risk factors? What's your medical history associated with it? I mean, there's things like people have extremely high blood pressures. Should they be on any form of estrogen? They've had a history of blood clots in their legs or their lungs. Should I be on estrogen? If, what can I take with that? And not to say that we're going to explain that here, but when somebody asks you your past medical history or your past family history, Those are the questions that we're also trying to get at. We need to really break that down, as well as how you're absolutely feeling during this time. So I see some questions coming in. I wanted to make sure you touched on all the four things. I know we talked about, that it is perimenopause, menopause. You're not crazy. Did you want to hit that while I read over some of the questions for you?
Yeah, I mean that's primarily the anxiety and the, being so hot and then just like you can't think and then I mean people don't really talk about this joint pain. My shoulder hurts now, my hip hurts. I can't do the things I used to do. I can't remember anything. I go upstairs to get something and I don't know what I got. And then I can't drive on the freeway anymore or I don't know what my husband's talking about. I mean, you're not crazy. It's just you're lacking estrogen and progesterone.
And thank you for, identifying that and helping women and people understand that these symptoms are very real. Just like we went through puberty, we going through perimenopause and menopause, and these symptoms are real. So questions in the chat. Should one of the questions is how much magnesium should be taken? Magnesium glycinate is preferred, but there are other formulations of magnesium. But how much magnesium?
Generally, it comes 125 milligrams. I usually say 2 tablets, but you can take up to four. I mean, it's beneficial. It's not harmful in any way. So it just depends on what you need to meet your needs.
Love it. And then I think we asked that question, answered the question of how long can I remain on HRT? Like they used to tell you once you hit 65, you have to stop. Any response to that?
I don't know where that came from, but I mean, you can stay on HRT as long as you want. I have 80-year-olds on HRT. I mean, most people don't stop it because you feel pretty incredible on it. So it's your choice if
Right.
you want to stop it. If you want to continue it, you can.
Yeah.
There's no age.
Right. I think during that WHI time and the aftermath of that, that's when people are like, "Oh,
Yeah,
if you're past this age, you can't start it. If you're past this age, you
right,
need to stop it." So
right.
that's one of the things. But always, always, always bring up with your provider if you're getting new diagnoses, kidney disease, worsening hypertension, whatever is going on with you. Make sure you have that conversation with your provider as well. Next question was, which provider should we be talking to about this? Should it be your, PCP, GYN, combination of both?
I think your gynecologist, and generally speaking, would be more informed about hormone replacement therapy.
Yeah, I definitely think unless somebody is, specifically taking the classes and doing the certifications and reading the articles, some people unfortunately can't get to a gynecologist unless they go through their primary care. So I always recommend that you have the conversation, and if somebody is not listening to you, then be willing to move along to the next person. Of course, if you need any advice on new GYNs that are up to date and forward thinking, you could always come through Viva Life, as well as Dr. Johnson's going to drop her information in the chat if you wanted to see her. Where are you located, Dr. Johnson?
I'm in Chicago, Illinois, and the office is at 500 North Michigan.
Awesome. And then I'm going to drop right in the chat you all for this is her website if you wanted to get that, rabyintegrativemedicine.com. And we had a nice comment that said, I was having all of those symptoms before I started taking hormone replacement therapy. And another person said, I literally started HRT therapy today. I had the anxiety, fragmented sleep, irritability, brain fog, and joint aches. So, congratulations. And I will tell you, most of my clients, and I'm sure yours, Dr. Johnson, when they started within 2 weeks, and sometimes the next day, they're like, oh my God, I feel so much better. What have I been?
Yeah, definitely, definitely.
Awesome. Let's see. We do have a question. What helps with vaginal dryness? Um, there's a little diet alternatives, exercise. What happens with vaginal dryness, and how do we address that?
Thank you for bringing that up because there's another aspect of sort of menopause. It's called genital urinary symptoms of menopause, and that's when you have like a lot of urinary symptoms. So sometimes you have incontinence, when you cough and sneeze, you leak, or when you can't make it to the bathroom, you leak, or you have really terrible vaginal dryness, kind of pins and needles with sexual intercourse, is how lots of people describe it. So everything kind of gets like falls down really. So the bladder falls sometimes, and then the urethra, which is the tube by which we use to urinate, that is like a door. It's like a door to the bladder. So sometimes that opens a little bit. You have higher incidence of getting bladder infections or frequent urination, and all that's a part of it's all a part of menopause. So a lot of times, in addition to bioidentical hormone replacement therapy, estrogen and progesterone, I'll have my patients use estrogen cream, something called estrace, and talk to your doctors. But generally, the way I prescribe it is it comes with the applicator. Forget the applicator. You want to put a little blueberry size on your index finger. And the estrogen and testosterone receptors are just in the lower third of the vagina. You don't need to go all the way up. And you want to rub it in like a moisturizer. So that's inside the vagina. And then on the outside, between the two lips, we call that the vestibule. And you can rub the estrogen on that as well as the entrance of the vagina. And that really helps urinary symptoms and vaginal dryness.
Yeah, I think that's really important. A lot of people don't talk about that genital urinary syndrome and menopause. And they're going through all these workups. I actually just had a client call me, I had intercourse, now I'm having this and this. And I'm like, well, we're going to have to rule out the things that could actually be a problem. So if you're having, bleeding or anything like that, we still got to rule out all the things, the infection, the inflammation, cancer, of course, as well. But more likely than not, if those simple things are ruled out, more likely than not, it's that you've had lower estrogen in the area of your vulva, vagina. And if you're starting to have intercourse again, well, guess what? We got to make sure it's moisturized. Make sure that we don't have those things in urinary tract infections. As well as generalized, somebody asked a question about generalized itching. So as long as we don't have a yeast infection or some other type of inflammatory process that's going on, then many times it is the lack of estrogen that's in the area. Did you have anything you wanted to add there, Dr. Johnson?
I do because there are women who can't take estrogen or don't want to take estrogen for various reasons. So
Mhm.
there's also something called Reverie, which is a hyaluronic acid suppository. You can use that. You can use coconut oil. If you can eat it, you can use it. So there's other things you can do. There's also a device called the Mona Lisa, and it makes micro tears in your vagina, and estrogen and collagen come back to the vagina, and so that's another thing. It doesn't have to be estrogen
And
if for
thank
some
you so
reason you
much.
can't.
Yeah, thank you so much because there's many different ways. And like we say, food is medicine, and many of the supplements that we use are plant-based. So that being said, there are opportunities for us to use other type of non-estrogen or non-hormonal medications or treatment supplements so that we can help with all these 50 symptoms of menopause that you may be experiencing. And last question, is the Mona Lisa painful and how does it work?
It's not really painful, but generally, by the time you make it to the Mona Lisa, that means you have vaginal dryness. So it's a little discomfort in putting it in the first time. So it's three treatments, 6 weeks apart. And how does it work? So it's a device that causes micro tears in the vagina. And those micro tears, whenever you get like a tear or a scratch or something, blood flow comes to that area to heal it. And so that's what happens. Intentional micro tears, and then you get blood flow and collagen to come to the vaginal area. It's very effective.
I think that's the website if you wanted to read more about it in the chat. But
Mhm.
we have reached our time and we know that we have busy people that are on the line. So we are so grateful, Dr. Johnson, for you taking the time today and talking with us. I have put her information in the chat, but if you wanted to just say it out loud again so that people that are listening, if they want to take it down and write it down, they can.
Yeah, so it's therabieinstitute.com. We are on staff at Northwestern. So it's the Raby Institute of Integrative Medicine at Northwestern.
Awesome. And everybody, I'm Dr. Kelly OMD, your board certified OBGYN and healthcare executive, and you've listened to Ask Dr. Kelly OMD. If you want more information about what we do, drkellyomd.com is where you go. We provide corporate sessions as well as individual and group sessions for you to better understand your health, especially your women's health. We want everybody to live their healthiest and wealthiest life and thrive. That being said, we're signing off. Dr. Johnson and I are going to stay on, but you all are free to go about your day and have a wonderful evening. Be alive.
Thank you for listening.
All right, all right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.